Hi, everybody. This is Bethany, Becky, and Kiesha here. We wanted to talk to you guys a little bit about just vitamin K and all the nuances around that option for your newborn. We want to chat about the different options around the injection, oral, doing it, not doing it, and just how you guys navigate as parents all of the information you receive around this topic. So, we know there's so much you have to wade through, and a lot of it can be fear based or maybe biased. And we really want to have a conversation without those things so that you can make an informed decision for you and your baby. So, thank you for being here and listening to this. We really, really hope it's helpful. This might be a little long, but we really want to talk about all the things that we may not have time for in a prenatal appointment. That's why we're doing this video. So if you're really, really interested in delving into every possible angle of this topic, that's why we're doing this. We love chatting about it. This is like what midwives, well, the three of us anyway, love chatting about it and every possible way of thinking about this topic. So we hope you enjoy it. Okay, so just to get started, Becky, if you don't mind starting with the definition, and the references we're going to use will go along with this video. So you'll see it below wherever you are listening to this.
Yeah, so I think the best place to start is to talk about what vitamin K is. It is a vitamin, as the name sounds. It's a soluble vitamin that we need in order for our blood to clot. It is not a clotting factor, but our bodies need it to activate clotting factors in our bodies. And so we don't actually make vitamin K ourselves, and we don't store it very well in our bodies. And so we get it from foods, and we also get it about 10% is also in gut bacteria. So there's two different forms of vitamin K. So babies are not they're born with very low vitamin K levels for reasons that we still are not really sure. Vitamin K doesn't seem to cross the placenta, and it also doesn't really transfer through breast milk. And so that means that breastfed babies have the lowest levels of vitamin K. There is vitamin K. I forget exactly how many times more, but I think 100 times more vitamin K in formula than there is breast milk. And so formula fed babies are obviously getting a lot more that way. So then what happens if we don't have enough vitamin K? The For the most part, our bodies do okay and they still clot fine. But in some cases, babies have what's called vitamin K deficiency bleeding, which exactly as the name says, it's just there's not enough vitamin K for the body to clot. And so a baby who doesn't have enough will just start to bleed suddenly, usually internally, where we can't see it. And in most severe cases, it's on the brain and can cause severe damage. So there aren't any, unfortunately, there's no warning signs, and nothing that you can really tell if it's happening until it's gotten more severe and you see that something's very wrong with the baby. There are a few different kinds of vitamin K deficiency bleeding. So there is so idiopathic means that we don't know the cause, which is pretty much all cases. Secondary, there's an underlying disorder, sometimes gallbladder disease, cystic fibrosis, or medication side effects. However, all these babies are usually exclusively breastfed as well. So it can happen early onset, which happens in the first 24 hours of life. Usually these cases are in babies whose moms did have medications such as blood thinners, Caesar medications, or tuberculosis medications. So usually that's when that happens in the first 24 hours. The classic onset is when it happens between 2 and 7 days, usually between 2 and 3 days, when vitamin K levels are the lowest. And then the bleeding usually sites are the gastrointestinal system, the umbilical cord site, the skin, nose, or circumcision site, if a baby is circumcised, obviously. Um, however, the cause of vitamin K deficiency bleeding is still considered unknown, but it's usually um, uh, breastfeeding or really poor feeding are major risk factors. And otherwise, they don't consider anything else to be a risk factor for it. And then there's late onset, late vitamin K deficiency bleeding, which happens happens after the first week of life, usually between 3 and 8 weeks, but can occur anytime within the first 6 months. So bleeding usually happens in the brain, skin, or gastrointestinal tract. And bleeding in the brain is often the first sign of late vitamin K deficiency bleeding. Usually happens in exclusively breastfed infants who have not received the vitamin K shot. So there are some infants who might be at higher risk, again, if they have undetected gallbladder disease, cystic fibrosis, chronic diarrhea, or antibiotic use. However, it's pretty much all in exclusively breastfed infants. So that's kind of what vitamin K is, and then the different types of vitamin K deficiency bleeding.
Thank you so much. Yeah, so kind of what we want to talk about is the risk of the injection and the many different ways of looking at that with the risk of vitamin K deficiency bleeding. So both have potential risk, and the injection does have potential benefit. So we know when you're looking at things online or talking to other parents or even having conversations with us, there's so many nuances around this. So that's what we want to get into. So here at North Texas Midwifery, we carry both types of vitamin K injection. They have different ingredients. We're happy to give you those of what you want to, if you want to do it, if you want to look at the different ingredients. Because they're shelf stable injections, they do have preservatives in them. They don't have heavy metals or things like that that I'm aware of, but they still do have preservatives. There has to be a way to sort of put the vitamin K in a liquid so it can be injected. So there's no way to have an injection without a preservative in it. So you want to keep that in mind.
Interject on that is that one of them is known as the preservative free, which can be a little bit confusing, right? So
Yeah,
just to be aware,
talk about
right?
that. I think a lot of birth workers call it the preservative free, but there's nothing. Maybe you can interject, Kiesha. I feel like that's said a lot, but there's nothing on the label that says it's preservative free, right?
Right. And it's really just, I'm trying to remember what it is that that some might feel that it's a better option. You know, it's fascinating. It is the one that's used in the hospital.
Mhm.
Are y'all aware of that? Or the
Mm-hmm.
hospitals we work with?
Yeah.
Yeah. And I find that fascinating because it's more expensive by far. But it has a longer list of ingredients. A lot of people feel that they're more naturally derived ingredients that are in foods that we consume. And so that's, I think, where some people feel there's a on the other side of it. The other one that you carry actually just has 3 ingredients in it. Um, so it just really depends on what folks are comfortable with, you know? So.
And then maybe we could talk a little bit, just while we're talking about ingredients and things, the oral vitamin K option too. So when people are researching all of this, you're probably going to find that that's an option as well. And I love chatting about it because you just want to use your critical thinking when you're considering it. So most of the options here for oral vitamin K, where you're literally giving the drops to your baby, are in like an olive oil base derived from plants. So while that is a more maybe ingredient list that you know, it's not as preservative heavy. I think we have to think about our baby's really meant to ingest something like that. We don't know long term how that's going to impact gut and their microbiome, because babies are really meant to ingest colostrum and breast milk, ideally. That's what their bodies are made to have. So we don't have, as far as I know, long-term studies on the impact of that. And I know the evidence-based birth article has a really good reference on it being fairly effective as long as you do the doses. So that's the thing to keep in mind with oral, is that it's not a one-time dose. You're going to have to do it several times so your newborn can ingest it. You can't give a ton of it at once because they really can't take all that in at once. So
Yeah, I think so far the Dutch protocol seems to be the one that has been studied to be most effective, and it actually is pretty close to the injection. But something about like what you're saying is, with the infant, are they meant to ingest this? You know, a lot of people don't realize this, but first of all, that infant starts with a sterile gut, and hopefully, you know, they're born vaginally at home. Or birth center, you know, in their family's environment. And so they start to get colonized. And so when we start to add things that are not breast milk, that can mess up that gut and that microbiome, because we're adding in something as it's trying to build its microbiome. But also, infants have a pH in the gut. And as soon as we introduce anything that's not breast milk, it changes their gut pH for the rest of their life, whether that's formula or olive oil, whatever that may be. It actually changes the pH of their gut. And so that's something just to consider. Again, as we're going to talk about, it's all risk and benefit and what you're comfortable with, but you know, it's just something to consider. What do you feel more comfortable with, something going directly into the bloodstream, or do you feel more comfortable with, you know, something that they can ingest and digest?
right. Absolutely. The other thing I know with the oral vitamin K that we have here, like I have my clients order their birth kit from In His Hands. The same company sells the oral vitamin K that you can purchase with your birth kit or order it later. And we don't have a great like prescription oral vitamin K here like they have in the UK. Like Kiesha mentioned, a lot of the studies on it are from the UK. And we can't say exactly for sure how much vitamin K is in each drop. So it makes it a little bit harder to know the exact risk benefit of oral vitamin K because we can't say for sure how much they're getting. It's likely you know somewhat, but when you're trying to reduce the risk of such a serious disease potential, you just want to keep that in mind too. So
Yeah. That's kind of the hardest part with the oral, is just the efficacy of it. You know, we don't know how much exactly they're getting. Brand to brand is different. And then really just the, you know, parents being able to remember to dose reliably. When I was a student, I remember we kept having people come in with their vitamin K droppers, and they would like at 2 weeks, and they'd say, here, we wanted to give this to you guys to give to someone else because we just haven't remembered. And obviously she's fine. And after a few people in a row, both my preceptor and I were like, clearly we're not explaining this well, because I think it's one thing to decline it, right? To say, okay, we understand a risk and we feel that it's low. And so we're going to decline thing. But if they got the drops to give the baby, then they felt there was a risk. And so somewhere along the way, we were doing them a disservice and not explaining to them the risk, because they thought they were out of the woods. Like, look at the baby. One, that's a problem, right? Can't look at the baby and say, okay, they're fine. And then we're just 2 weeks old, you know, and that's when the most catastrophic bleeds begin to happen. And we can't tell at that point. And so we started to reframe, spoke about it with people, because obviously, you know, there was a miscommunication. So,
yeah, absolutely. So maybe we could get into that. I think usually with this whole conversation, that's kind of the next thing we talk about is like, is there a way for us to know? Like, can you tell me if my baby's bruised at birth, that my baby's more at risk? Maybe then I should do it. Or maybe I'm thinking about circumcising. I don't know yet, whatever. Um, and I want to do it for that. Or maybe I did it for my son because he was circumcised, but now I'm having a girl, so I don't need to do it anymore, right? Whoever wants to take that, all those questions.
yeah.
Yeah, it's a lot of
Yeah.
questions.
So I think that just first of all, understanding, which Becky, you already went over and hit on. I mean, it's a deficiency problem, right? And there's not really a whole lot that puts a baby at risk, except for we do know that the cases are from breastfed babies, which would put our clientele most of the time, at 100% risk. But otherwise, we can't look at a baby and say, well, you're fine. I have recommended to clients after hard births that maybe were declining, like, hey, I really think that this is a good idea, and here are the reasons why. If we had like a shoulder dystocia, for instance, that happened, Bethany and I, you were with me, and we suggested, please consider it. But we don't know. Like we just don't know. And the risk. Oh, and so I think that, again, we're going to say this probably a few times, but it comes down to your comfortability of that risk factor, right? Are you comfortable with the percentage of risk that your baby could be? Because there's nothing we can look at and tell you, like, hey, you're really healthy, or hey, that birth was really butter and smooth, and so your baby's not going to have it, because there's just no correlation there at all. And so I guess with that, one of the things people will say, okay, well, can I take more vitamin K myself in pregnancy? Can that reduce the risk? I mean, I get that a whole lot when we start talking about there's nothing that, we can show you that changes your risk. And in fact, there have been studies done on this with moms where they even gave them an injection at delivery.
Mm-hmm.
So the moms were on vitamin A, throughout pregnancy, towards the end of pregnancy. And then right before they had the baby, they even gave them, a dose, IM, and these babies still came out with the same deficiency. So there's just really not a lot we can do to prevent it. And I think that's what makes it the hardest, because in midwifery care, we do so much to prevent. We're used to that. Our clients are used to that. Like, hey, what can I do? I'm committed. I will do whatever it takes to prevent. And this is a hard one because we can't prevent it. And it goes back to, we don't know why. Like, why are they just meant to be this way? Is our microbiome broken down so much that we just can't synthesize it in the way that we were originally created to, or is actually thing that's protective for the baby? Like, we just simply don't know. So because we don't know, there's not anything that can be done prophylactically to prevent it.
Yeah. I think too, that is something, you mentioned maybe like, why do we need this if maybe it's supposed to be this way? But I think, we don't know, and maybe we'll know more in the future. But, I think we can look at the world and see a lot of things. Like, it's recommended you give your baby vitamin D drops too. And, there's a lot of other things that we take as humans, because we're lacking and deficient in it, just because we live in a broken world. And I think the ultimate, I think this decision for parents ultimately comes down to weighing your risk and benefits and what you feel most comfortable with. Like, we don't, unfortunately, as with most decisions, there's not a risk-free option. There's, having a home birth is not risk-free. Having a hospital birth is not risk-free. Like, we just don't, there's not a risk-free option. And so, and same with vitamin K, there's some small risks to the injection. And then there's risks to not doing the injection. And so I think, you have to decide. And I think all of us as midwives feel really passionate that, our clients just have all of the information, and can really make an informed decision and feel really comfortable with what they're deciding for their baby, and choosing which benefits they feel outweigh the risk.
Right. And I think something you said to me a while back, Bethany, just in giving me advice with a specific client at one time or another, was that, our clients are strong and they can handle the information and all of it, without it causing fear. And sometimes I think that people perceive us giving all the information as biased. It's not. We just feel that you cannot make a solid, sound decision without having all the information. And we just believe, clients, you can handle this. That's why you chose midwifery care, because you want to know all of the information. It's our job to share that with you so that you can make the best decision and not just say, oh, you don't need it, or, oh, I suggest you do it. That is what makes us different. That's what makes our model of care different, is coming alongside you, saying, here's the information, and then ultimately support you in whatever decision that is, you know?
Absolutely.
Mhm.
Yeah. We absolutely believe like women are strong. We believe you can have all the information and decide what's best for you. And I think we all feel so strongly that, to withhold some of this information is actually us making a decision for you. Because if we're not saying all this, we're not telling you what could happen, we minimize the information, and we may sway you to decide not to do it, which is not fair. Like, that's us having more power, and that's all. That is not what we're about at all. So we know it's scary thinking about vitamin K deficiency bleeding, and we know, especially nowadays on the World Wide Web, it's scary what a lot of people say about getting it too. We know that.
Mhm.
And there's just so much fear mongering on both sides. But
And
as
we just really shouldn't be, so I'm sorry. Go ahead.
go ahead. No, go ahead.
I was going to say, we just shouldn't be forced to make decisions out of fear,
Mhm.
ever. That is just not what we're about at all. And so
Mhm.
people do come and sit in front of us for appointments and bring up topics. And we later find out that the reason is because they were on a Facebook group or they were on Instagram to scare them. And that's no different than, their in-laws scaring them about having a home birth. It's the same thing. They
Mhm.
should be given an opportunity to take in all the information and make a judgment call, because that's what you're going to do as a parent. This
Mhm.
is the beginning of that journey of researching, learning, hearing both sides of the aisle, and then ultimately making the best decision for you, your family, this particular
Mhm.
child. I mean, I'll say that, having, Becky, I know you have two, I have three, and I have made different decisions when it comes to certain health decisions like this for each one of them based on that child, So I think that it doesn't always have to be so black and white. It
Yeah.
really has to be your own parental decision. So,
Absolutely. And we have more information, where you were for each baby, your age, your experience, like all of that impacts the decision you made. So you don't have to make the
yeah,
decision at all for each child. Like, same thing
right.
or whatever it is. Like,
Mhm.
so, and we all, I mean, I think even for me over time with new evidence, I've drastically changed my opinions on this topic, like over
Right. Right. Right.
and what I know now.
Yeah.
So, yeah. Anyways, I know we touched a little bit on, and one of the things I hear the most from clients is, you know, I really believe babies are deficient for a reason. Like, God made them that way. We don't know fully why. So I just feel more comfortable not having the vitamin K, which we do understand that. I think we touched on it a little bit. Like, we don't fully know why it's this way. Is this a result? I know most of our clients are believers. We're all believers. So I'm speaking that way, with certain, you know, language that believers use. Um, we don't know, is this a result of the fall, or is this like you know, a post creation thing? But I think, like we said, if obviously we believe disease is a result of living in a broken world, and that's not at all how our creator intended things to be. And vitamin K deficiency bleeding is not like how things are supposed to be. Now, whether babies are supposed to have certain levels of vitamin K or not isn't the thing. It's we just don't know which ones are going to have a problem with having low levels of vitamin K. Most are going to be fine, but some are going to have the
Mhm.
vitamin K deficiency bleeding, and it's just impossible for us to know which is which, right? So, and like Becky said, a lot of us take prenatal vitamins. A lot of us do a lot of different things. If certain complications arise in birth, we would also use medications in those situations. Um, so depending on how you're looking at it theologically, sometimes you have to zoom out a little bit beyond just vitamin K, like how you're applying it to all your decisions too. So I know some resources, especially like I recently listened to a video that basically said babies were born with low vitamin K, and to get the vitamin K shot is to lack faith or not trust the creator. And that is just not fair at all. And that's a lot of shame and guilt to put on parents, to say if you get the vitamin K, then you lack faith or something like that. And that's never
I mean,
anything any of us would ever want you to experience in our practice at all, ever. Like, also, if your friends are saying that, please reconsider having them as friends. Like, we are a shame and guilt-free practice, and that's because the Lord is guilt-free, but I will avoid going on our rants about that.
I
But
mean, you could
anyways,
apply that so much. You could apply that's never ending, that idea, that theory to say that. Yeah, first of all, I mean, it's just shame. And that changes, do you believe that we are broken people in a broken world, right? So you do or you don't, which that person clearly does if that's how they're speaking, but they're not understanding that, okay, so do we not take prenatal vitamins? So do we not have a midwife? Because midwives are, I mean,
midwives are there and
arguably the old,
things happen.
yeah. Right. So I mean, I guess what I've say, yeah, that's just like a never ending cycle. You can't go there with that, as we are broken people in a broken world. So things do happen. So we do have to consider preventing. That's not faith. So
Yeah. And I
anyways,
mean, another
that's a whole
angle
nother.
to look at it too, it's just that, like there's other systems of newborns that are immature at birth. Like, I mean, babies are not born with, like, they have an immune system, but it has no immunity yet.
Mhm.
And they have, like their brains are not fully developed. There's a lot of things that are not fully developed. And so, looking at as their clotting factors are not fully developed yet. And so it leaves them susceptible to this disease, just like they are to other things. And some babies, you know, this happens to, and others it doesn't.
Right.
Yeah. I mean, I think it goes, and I think it's the evidence-based birth article that talks about this. I could be wrong. That says, well, you can just look at it from a survival of the fittest viewpoint.
Mm-hmm.
I think if you choose to do that, then you choose to do that, you know? I think, is it that, do you guys remember, is
It
it the
is. Yeah.
evidence-based birth?
Yeah.
Yeah. And I think that's a hard thing to say because none of us want to really think about it, but I think it is kind of a hard reality to like realize you kind of have to choose how you're going to categorize yourself. And so that doesn't mean that you're saying, oh, well, if I don't get the vitamin K shot or do the drops or something, that I believe in survival of the fittest. I think what it says is we're not going to fear and shame and guilt to make this decision. We're going to step outside of that and we're going to look at these
Yeah.
statistics. We're going to look at the risk and the benefit, and then we're going to make the decision that we feel is best for our baby. That's what it is. It has nothing to do
Mm-hmm.
with whatever decision you make says something about you. And I think that that's where we've landed. And that's where the vitamin K gets put into the vaccine group, right? Where we've become either, pro-vax or anti-vax. And then that says everything about you and your belief system and who you are. And so people feel like, oh, if I'm choosing the vitamin K shot, then now I am this person. And
Mm-hmm.
for us, practice, I think what we're saying is that's not where we land. We would like for people to step outside of that and then to just look at the statistics, the facts, have an understanding of what this is, and be able to make a sound decision. It's not a label. It's just what is
Mm-hmm.
the best decision for you.
Yep.
And your identity should not being a crunchy mom anyways. But we did want, I said that at the beginning, but the vitamin K is not a vaccine. There's a lot of information that puts vitamin K in the same category as vaccines. It is an injection, but it does not, inoculate in a way where with some kind of inflammatory ingredients that cause the body to have an inflammatory response and build antibodies to it. The vitamin K shot is not that at all. It is a vitamin with preservatives to address vitamin K deficiency bleeding. We're not saying it's only a vitamin K. It does have preservatives in it, but it's also not a vaccine. Now I know there's a lot out there about vitamin K, especially the injection having a black box warning. Maybe we could talk about that a little bit. Because I know that comes up, especially when you look on the World Wide Web.
Yeah. I think quickly before that, touching on just the guilt and shame thing, I think, in this day and age, especially with the internet, no matter what you choose, there's people who are going to tell you that you're going to kill your child. Like it's that like extreme, no matter what it is. There's just such extreme viewpoints. And I think there is, which our whole point of this conversation is that there is actually a lot more nuance to all of those discussions, whether it's vaccines, whether it's breastfed and formula fed, whether it's vitamin K. All of these conversations are much more nuanced to that. And I think, yeah, it's really important that you have the freedom to be able to make that decision without judgment, without shame, and you just choosing and being empowered to make the best decision for your family. And hopefully you're in a community where that is supported, even if it's not what someone else chose.
Right.
So.
Absolutely.
Yeah.
Yeah. Thank you.
The black box warning.
Yes. Talk about that, Kiesha.
Oh, am I going to talk about the black box? I don't have. See, I should have had my computer, and I don't have my actual notes in front of me. I think that my face disappears whenever I go to them. Does it? Y'all can tell me.
Nope, you're still there.
Does my? Oh, okay. Well, good. I mean, y'all can talk if you want for a second, and I'll look up what I.
Yeah, I mean, I say, which you guys can add. I mean, that's why we're doing this, because I love having all three of our thoughts on here, which hopefully just gives more value to everybody because you're hearing from 3 midwives, not just one. I usually say, like, yes, there is a risk with any injection. It doesn't matter if you're injecting the cleanest thing ever. Like, doesn't matter what you're injecting, you could inject in the wrong area and that can cause risk. So a lot of the risk listed on the injection box or like the insert is from not injecting it properly and having complications from that. And then there is some risk of maybe having an allergic reaction, but that is
well, there's actually only been one documented like severe allergic reaction, which was I think about 10 years ago, in like millions of doses. But
which is
so I think
so. Go ahead.
I think okay. Oh, now I can only see myself.
You can still
no.
see.
We can see you.
I'm just gonna talk.
Yeah. No.
Okay. It's weird because so one of the things is that there's actually a difference between IV and IM. That's what I had written down. And a lot of these side effects are really actually more so referencing the IV. So when we're giving an injection, we're doing intramuscularly to the newborn versus an actual IV, which they're only going to use that to actually treat a bleed in a baby. And then that's when they would give the IV. So that's one. And then another is the biggest reason, I believe, you guys could tell me if I'm wrong, that black box is on there is the actual injecting. And something that I have found, like a lot of midwives don't know this, and I see a lot of students that don't know this, but whenever you're injecting, the needle into the baby, you should actually pause. Like, so once you put the needle in, you should pause and you should pull back a little bit just to make sure that there's no flash of blood, because we don't want to actually be in a vessel. That should be standard. That should be what you do every single time you inject.
Right.
And so if you were to inject the vessel, that could be what that would come from as well. So those are the nuances, I think, that just often aren't explained when we're talking about the severe side effects. We don't go into the whys behind it, or like what could be prevented potentially, you know?
Mhm.
Oh, I got my whole screen, figured it out. That whole time I couldn't see you guys. I can only see me.
Hey,
Anyways.
we were just nodding and smiling. Yes.
Yeah, like, it was like an option to like put a like filter on my face, and I was like, yeah, I don't know. So anyways, I'm
That's a good point.
yeah.
Oh,
So
can you
can
hear
you hear
me?
me? Go ahead.
Okay,
Yeah.
I was just gonna say, I think that's a good point, because I'd always give out the inserts if people want to read it, just to be transparent. I mean, it's your baby, it's your risk benefit, what you feel comfortable with, and it can be really scary when you're reading it. But like you said, a lot of that is intravenous, and then if someone's injecting it properly, the risk should be really quite low. Um,
Mhm.
really quite low. So you have to compare, the risk of someone injecting it properly with the risk of hemorrhagic disease of the newborn. Excuse me, vitamin K deficiency bleeding. I'm used to the old fashioned name. So,
Yeah, I know. So, those are kind of the big black box label things we're talking about. I know another really common one that's floating around right now is having jaundice, right? So the vitamin K injection being the cause of jaundice. And I just wanted to bring up, this was also in my notes that just reminded me of um the worst case of jaundice I have ever had, to the degree that when consulting a Harvard graduated pediatrician who studied overseas in other countries, it was the worst case she's ever seen. They did not get the vitamin K injection. You know, so there's that. There's also a normal amount of jaundice that's expected. I know Dr. Jack
Mhm.
Newman talks quite about that. That's actually a very normal process for the newborn to go through, which is, as midwives, what we understand and know to be true, which is why we address it completely different. So I think that that's kind of, I would love to see the proof on that, I guess, is
Yeah.
yeah,
going.
so
Yeah.
maybe we could talk a little bit about that. Like, basically, the short story is, in the womb, babies have more red blood cells because of how they oxygenate. So once they are out of the womb, they're breathing room air, they don't need as many red blood cells. That is like the short version. So when that breaks down, it results, like, the
Mhm.
product sort of is bilirubin, which is how you get that yellow in the skin and eyes. And a lot of it they're going to excrete out through urine, bowel movements, and then through their skin. So if they're eating adequately, they really should clear the jaundice normally. Great. Um, but really severe cases, like you said, it's probably not from the vitamin K. It's probably from underlying diseases, like ABO incompatibility and other complicated things, liver issues. So a lot of my clients do decline the vitamin K, and I see similar amounts of jaundice. So I don't think
Right.
getting the vitamin K is going to result in jaundice so bad that you're going to probably have more interventions for your baby, is what I think we're talking about. You're probably not going to have jaundice so bad that you're going to be separated with lights and like have all these interventions and ended up formula feeding and all these things. That's probably not a connection, because most babies have jaundice, and that's normal because it's physiological jaundice most of the time.
Right. And I think it's hard if your baby is the baby, which I know for us in our practice, we have really low instance of jaundice that actually needs to be treated outside of what we can manage, right? But say we do, that baby was one of them for me, the only one I've ever had to. It can be really easy to recall the things you saw on social media injection caused this, right? And I think that that's just something that that's why I wanted to bring it up and address it, is that if you are that person that ends up needing extra care for your baby, it's not because you gave your baby the vitamin K.
Yeah.
I don't, do you guys know of any actual evidence or studies on a correlation or connection with that?
No, I don't
No.
actually
So
know where
just
that
because
comes from.
yeah, exactly. So yeah.
If you find something though, please send it to us because we will want to
Yeah.
learn. Um,
Yeah.
and there, I mean, I would say too, you know, jaundice is sort of told as this really dangerous thing, and it can become dangerous. It can cause brain damage, but in very, very, very high doses that are so, so rare. And, you
Well, and
know,
that's almost always pathologic jaundice, which has
Exactly. And that I
a
was going to
disease
say, like,
cause.
right, this specific baby, that's what was going on. And that is generally that's what's going on. So that has nothing to do with vitamin K not doing the vitamin K, because there's something underlying going on in the first place. So
Mhm.
yeah.
Yeah. And I think, I mean, the other thing, the big scary thing that people hear and goes around is the risk associated with cancer and the vitamin K shot.
Yeah.
Um,
Right.
which, I mean, everyone has their bias. And so depending on how they look at things is how they're going to interpret information. But, I mean, long story short, the research that we have, there isn't an association of childhood cancer, especially leukemia in particular, with it. There's a lot more like in-depth information, which if either of you want to go into that,
Yeah.
you can read it. But it's also on evidence-based birth. They go into all the studies that found an association, but then for follow-up studies, basically nothing could ever find an association um with the injection. So
Right. Yeah, because there's a lot of nuance to that. It's like, what else was going on
yeah,
with that particular baby?
there's so many factors, and I think it's hard. It's hard enough. I mean, we read a lot of research. We were trained to read research. And honestly, it's hard enough for me to like interpret studies and figure out what they're actually saying and what's a good study, what's a bad study, what does this mean? And I think, yeah, it's hard to kind of um, do that. But there's so many variables, and even like, we love anecdotal evidence, and there is truth in anecdotal evidence, especially as midwives. We have traditions, we lean on each other for things, but the reality is, like a good study has very few variables. And so, we can hear these stories of, oh, well, this kid got the vitamin K or got vaccines and has all of these problems, and this kid didn't and is fine. And I think, it's easy to think, oh, that's what caused it. But, you know, uh, correlation and causation are very different things. And so, like, they might have had that and have this, but we have no idea if that's what was causing it. There's just so many variables. And I think when we look at, like, when you actually look at statistics of, the vitamin K injection, kids who get it, kids who don't, the number of babies who actually get vitamin K deficiency bleeding is small. But if it's your baby, that's everything. And so I think, the truth is people are going to say, you might get this, you might get this, you might have this. And the truth is we don't want your decision to be out of fear. And the truth is, statistically, the vast majority of babies, whether they get it or not, are going to be okay. But there is the chance that your baby that someone's baby is going to be the statistic. And so I think it's really, as a parent, we both had to make this, I had to make this decision for my boys, like what you really feel most comfortable with and what risks you feel most comfortable taking.
Yeah. I mean, I have a friend who does fall in a 1% category when it comes to babies and having babies. And so something she tells me all the time is it doesn't matter if it's 1%, if you're the 1%.
Yeah.
And again, that's not here, but that's putting yourself in those shoes. Okay, well, if I was the 1%, how would I feel about this decision?
Yeah.
And I think when making decisions around injecting your children with something or having your baby, maybe even outside of a hospital, or I would say flipping that and choosing to have your baby in a hospital, all of those things we have to think about, am I okay with it if that statistic occurs? Which one am I more okay with? Which one can I live with? What have I thought about this to the degree in which I was willing to take the risk in this camp or that camp, and going back earlier, that's just kind of welcome to parenthood. And that's what this is. So,
yeah.
There was something else as we were talking about the jaundice that I wanted to bring up, another kind of common risk, but I can't think of it right now. So if I think of it, or maybe one of you guys, your memory will be jogged if there's anything else
No, I wanted to
that's common.
Just that we don't want to bypass all of this by saying, well, I did this for my kid, so it's probably fine if you do X. Like, that's why we're not appointments for all of us. I'm always asked, well, what would you do if it was your baby? And that's why we hesitate or don't say or respond to that, because we don't want to create this false sense of security because something was great for me, then it'll also be great for you. Because we can't guarantee that. That's not necessarily reality. In a way, that's the decision for you, which is not what we ever want to encourage, because it's your baby and you have to live with your decision where we don't. So
that's funny. You said false sense of security. I went over to my notes to see, and the other thing I jotted down was just, I think sometimes in the natural world, the non-vaccine world, which again, this is not a vaccine, but there is a false sense of security painted in not injecting anything into your child. So if you breastfeed a baby, especially if your baby was born vaginally, and if you don't inject anything into your baby's going to be so healthy compared to your friends' babies that had all the things. And the security, I can speak to that on a personal note. Like my sickest, quote unquote, my baby who gets the sick the most was the one who had the least amount, who had the perfect start, and my one who put me on a midwifery track because it was never get sick. And I've seen that over and over again. The more clients we have that have multiple children, we get to know them, we know their stories, we know when their kids get sick and things like that. That's just not true. And it's a very, very naive and false security to think that we can control those things, and that can really leave parents feeling super inequipped to handle what might come along, right? But I didn't do any of those things that would put my baby at risk or my child at risk. And then when it comes along, they're not equipped and they don't know what to do. And so I think that that's another misleading piece to finding these things. And again, fear. It's kind of like, oh, but if you don't, if you do this, then you're setting up your child for a life of sickness, and then the first time they get an ear infection, it was that vitamin shot, and that's not how it works. And that's not fair. So,
yeah,
absolutely. Like there's so many variables, right? Like how many women choose a more natural lifestyle because they already feel sick, or like, I'm sorry if you can hear my dog. Or already feel like they have an autoimmune disease or all these different things, and then it puts them on a path and then choose home birth and things like that. Like they already have things going on sometimes that are already in the natural world, and sometimes whether that's stress or your microbiome or mineral depletion or whatever you think it is, sometimes that passed down to your kiddos, and that doesn't mean you messed up or did something wrong or whatever. But like Becky said earlier, there's so many variables to illness and why things happen and when they don't. We can't say if you do things a certain way and eat a certain way and do all this stuff
Mhm.
right and only use essential oils, then you're gonna be fine. And your baby's never gonna have, vitamin K deficiency bleeding. Like, that's not true. Like, so
Yeah,
if it was, that would be amazing. And
I
we
know.
how to do it so you can get a certain outcome, because we want you to have that outcome too, but it doesn't it doesn't work that way
Mm.
in life. So
I think my personality in particular really wants A plus B to equal C. And so if I do these things, then this will happen. And I think we see it in birth all the time. Moms do every single thing to prepare for the best birth possible. And there's just variables that are out of their control, and they don't get the outcome that they want. Or moms honestly just kind of live life and baby comes out. And so you just see all these different things, and in life, just A plus B doesn't always equal C. And so we don't, I get it, especially as a parent, you're choosing something for your kid and you want to make the very best decisions for them. You want to prevent illness. You want to prevent, bad things happening to them, as much as possible. And you want to make the right decision. And I feel that deeply and wrestled so much making decisions for my boys. Um, and I think there is an element too of you have to look, you look at the research, you look at what you know, and you make the best decision. And then you also just kind of have to let go to some degree of, like I can't control everything, and I can make the best decision with the information that I have at that point. You might learn something later and can make a different decision. But knowing you made what you thought was best at that moment, um, and kind of letting go of the rest.
yeah.
Mm-hmm. Yeah.
And trust yourself and your decision that you did do your best in that moment.
Yeah.
Yeah.
Anything else we
Well,
wanted to know?
I hope we painted a picture of helping people critically think through the decision making process. I know that information is available, like too much of it out there on it, and you covered it at the beginning, Becky, of just like what it is, what we're concerned about. But I think the more so the takeaway and the reason you wanted to put this together, Bethany, was to help people have the time to stop and to critically think through what it is so that they feel equipped to make the decision. So
Mhm.
I know we're the risks and really talking about what happens if you don't do it, and maybe some of the misconceptions of getting the vitamin K, and it could potentially sound like we're painting a picture of one side. I don't think that that's the case. It's really just that unfortunately a lot of the information that's out there is just so fear-based, and so we have to be able to break that down for people and pull that apart. They can understand it.
Yeah, and I think we always hope to encourage people to look at both sides of it. So there's going to be people that are really for it and really people that are really against it. And so looking at both sides of that, we all have our own bias and our own thoughts going into things, but I think as much as possible, if we can look at all of the information to really make an informed choice, that would be our hope for our clients.
Yeah. And then we support you in
Yeah,
whatever that is.
absolutely. I would think all of us
Yeah.
probably, I think we all have clients who choose both to
Yep.
do it and to not do it. I
Absolutely.
think for me, it's pretty equally. So,
Yeah.
Right. And I think that that's what I often tell clients is like really good information. It should be where people take in the information and 50% would choose it and 50% wouldn't. If we have really high rates one way or the other, it can be we're giving very biased information. And our intention is not to be confusing, not to make it harder for you. It's not that we're trying to withhold anything from you, because I know I've had clients just be like, just tell me what to do. I'm like, no, you have
Yep.
to make a decision and and just be confident that you're doing your best. So
yeah. And I
Yeah.
think too that like the reason we can't make decisions for someone is because we don't have to live with the outcome of those
Right.
decisions. And so,
Mhm.
like for ourselves, for our families, like we live with those decisions and whatever the outcomes may be. And so I think for us, that's why we don't want to make that decision for someone else is because they're the only ones that are going to live with that outcome. And so it's really important that they feel confident in standing by that.
absolutely.
Yeah. Mm.
Yeah, I think for us, I think we all feel responsible, like before God, to give all the information in an unbiased way, because we're responsible to do that. But after that, it's up to parents what they want to do.
Right. Lost me for a second. Sorry. What I was going to say is I don't want the responsibility. I've told my clients that before. We have a lot of responsibility as their midwife, and on the things they can make the decisions on, we want them to take responsibility for that. And honestly, they're going to be happy they did. Like you'll be happy that you were confident in your decision. So
Mhm.
Yeah, absolutely. Great. Any final thoughts? Anything else you guys wanted to chat about with vitamin K? I feel like we covered a lot. It's great.
yeah, I feel good about it.
Well, thank you guys so much. Recap is just there's risk of vitamin K deficiency bleeding, there's risk of the injection. So below the video will be references for both, and then the inserts for the injections. And I'll put a link to the oral vitamin K too, in case people want to look into that. So thanks so much, Becky and Kiesha. I appreciate your time and just sharing your thoughts.